Yeah. In this morning's medical alert, AbsoluteCare in Baltimore is celebrating a big anniversary this year. The company aims at helping people who may fall through the cracks of the traditional healthcare system. And joining us live this morning with more is Chief Clinical Officer Dr. Anup Raman. Good morning.
Morning.
So tell me about AbsoluteCare.
So AbsoluteCare is probably the most incredible and unique organization in America today. I genuinely believe that. And the reason for that is we provide concierge care, but for the sickest instead of the richest, right? So what do I mean by concierge care for the sickest? Essentially, insurance companies, payers, will assign their most medically complex, socially vulnerable people to us, and we'll take clinical and financial responsibility for making them healthier again, right? And by concierge care, what we do is, when you think about the traditional primary care doctor's office, it is 2,000 patients that a PCP sees in a given year. They are doing 20 to 30 visits per day. They, spend 10 to 15 minutes with you, and then you walk out and you're trying to remember, like, what did that doctor say? And so the way that we approach this is, when we're assigned a group of patients, we slow down. We slow down the practice of medicine.
And you have wraparound services.
Exactly. So there's sort of two main elements to our model, right? The secret sauce is we're starting with the population that lacks trust in the health system. They've been to the hospital 10, 15 times in 1 year and not gotten better, right? And so there's two things when you're trying to rebuild trust with somebody. It is, you need to create time, right, and build a relationship, and you need to follow through. So when you make a promise, you need to actually make that happen. And so our docs will work with a team of people. They see about 300 patients in a given year. They see about 10 to 12 patients in a day, and they spend a half an hour to an hour with each patient, right? So you got time with your provider, and then there's a whole team. Each PCP works their own nurse, own social worker, own behavioral health specialist, and so so when you identify an issue, you actually have a team that follows through. And with that approach, what we see is that the people who are assigned to us, the quality of their health, whether it's their blood pressure control, their diabetes coming under control, that all improves, and the cost of their care actually goes down, right?
Yeah, a lot of the issues that we see with some of the sickest individuals is usually the social determinants of health, the access to transportation, being able to get back and forth to the doctors, especially when you have to work. So by you all providing all of that in the same space, it really just takes away those barriers.
Exactly. So,
but you guys don't just accept walk-ins.
We don't. So members are assigned to us. So when you think about, I'll just give you a quick patient story, right? So we take patients with, on average, 10 plus medical diagnoses. They're on 10 plus medications. They've got oftentimes behavioral health or serious mental illness. They oftentimes struggle with addiction, and they have the social determinants of health issues like housing or transportation. And so what does that look like on an individual person level? So a patient of ours, for example, Mr. B, we'll call him, he struggled with alcohol use disorder, bipolar disorder. He developed gastrointestinal bleeding issues, and he went to the hospital between January and August 200 times.
Wow.
Right? And when our team finally encountered him, to your point, they didn't start with, hey, you need to take your medicines, right? We started with, well, you're struggling with housing issues. What's the cure to homelessness? A home. Right. So we actually rented our patient an apartment, got him paired with a community health worker who got him kitchen utensils, got him bedding, checked in on him regularly. Once we established that trust and he had an address, what we could do is then talk to him, you know what, let's get you to your GI doctor and actually get that endoscopy. Let us give you some medications for your alcohol use. And over time, he went from over 200 visits in a year to less than 3 in the past 3 years.
That's amazing.
Yeah.
You guys have been around for 25 years.
Yep.
What are you doing differently now than you did when you started, and are you looking to expand it all?
Yeah, so I sometimes call us the world's oldest startup, right? We're 25 years old, but we feel like a startup because we're constantly learning. No one else does what we do, which is take care of the sickest 5% of folks on public insurance at scale. So our roots are actually in Atlanta, where we developed this model treating folks primarily living with HIV. And then about a decade ago, we came to Baltimore and switched to this value-based care model where instead of patients just walking in to see us, insurance companies assign us our patients. And that's really powerful because we're actually a for-profit organization, which is unique in Medicaid, right? So we found a way to do this work in a financially sustainable way through reducing waste in the system. It's not fraud, it's just our system is generally fee-for-service, meaning we do more visits to people. It's not actually trying to make people healthier, right? And once we figured out how to do that and have a sustainable business model, we've now scaled to 11 different cities in America. And within Baltimore itself, in just the last year, we now take care of 1% of all Baltimoreans, right? The sickest 1%. And so my hope is, as years go by, you see that impact from a public health perspective in the city, that the sickest individuals in the city are doing significantly better, and that there's an Absolute Care in every city across the country.
I was going to say, because you started in Atlanta, you have one location here in downtown Baltimore, you're in Cleveland and all these other different places. How come there are not more centers like this?
Well, we're coming. So in the last, we figured out the model over the last, let's say, decade. In the past 5 years, we've gone from 3 sites to 11 sites, and I'm hoping we used to say every major football town in America. Now we'll go to minor league baseball towns.
Okay.
As well.
Well, where can people learn more about your center?
Yeah, so just go to AbsoluteCare.com. And I would say, again, most of our patients are assigned to us, right? So I actually hope, just like I hope no one ends up in the intensive care unit in a hospital, but we're happy to know that it's there if you need us.
Yeah.
I hope you know that we're there if you need us. We're in the background. I hope you never get assigned to us. But if you really care about doing mission-driven healthcare, look us up, AbsoluteCare.com.
Awesome. Well, Dr. Rahman, thank you so much for coming and talking to us. Congratulations on 25 years.
Thank you.
All right, well, stay with us. We'll be